useless analyses during insomnia. It seems the more analyses you give, the more in general there will be information on the basis of which you can make the correct diagnosis, and in particular in relation to insomnia, and effectively treat it. Often this is far from the case. And in this video, I will tell you which analyses are useless for making the correct diagnosis and accordingly treating insomnia. You will simply waste time, energy, and money, and you won't get any results that would help solve the problem. And if you watch this video to the end, I will give you a fairly short and gentle list of tests that really need to be taken. And actually speaking, there are corresponding clinical recommendations in which these tests are listed. And obviously, if there are any disturbances, they need to be corrected to ensure normal sleep. First is melatonin. Well, it would seem this is the sleep hormone, and everyone talks about how extremely important it is that if it is produced, then a person sleeps, and if it is not produced, some disturbances, then a person does not sleep. But the devil, as they say, is in the details. Firstly, to look at the profile of melatonin, and it is not constantly produced in us. It has what is called a circadian rhythm. The increase in melatonin production begins in the evening, before sleep. The peak of production is in the first half of the night, then a decrease, and during the day a minimal level of melatonin. And here's the question, that a one-time analysis says little about what it's talking about at all. Therefore, it is essential to examine melatonin's profile. But more than that, there are practically no serious standardized laboratories or analyses now, because the same analysis, if given to different laboratories and such experiments in general were conducted, the results obtained from different laboratories turned out to be very different. That is, in this way, those tests that detect melatonin, they are still not very accurate. Next, each person has their own level of melatonin production, and the norms, they are also very approximate. For some, this may be normal, while for others, this may be completely abnormal individually. In this sense, the indicators themselves, they often cannot differentiate disease from health. On the one hand, we can see some pathological indicators of melatonin, and a person sleeps perfectly well with this, and someone has normal melatonin, but the person has insomnia. Thus, it's not a very sensitive and not a very specific method. Moreover, the very process of sampling, it can be blood, it can be saliva, but if you slightly incorrectly collected saliva, and God forbid the person has periodontitis and the gums simply bleed and blood gets into the saliva, that's it, the results will be completely incorrect. It's now pointless to do a melatonin analysis, and I would underline that in no clinical recommendations of the American Academy of Sleep Medicine, European, Russian, there are no indications to do a melatonin analysis and make any clinical conclusions on how to treat a person from it. I know that some people start taking melatonin supplements on their own when they have insomnia. Is it necessary to do this, or is it dangerous? Here's an interesting point. On one hand, self-medication is in general not a good thing, and you should, of course, consult a doctor. But on the other hand, even in clinical recommendations, especially for older people, it's said that if you have poor sleep, especially somewhere after 55 years old, there might be a decrease in the peak production of melatonin before sleep, and you can undergo what's called a trial treatment. That is, if melatonin drugs are prescribed and a person's sleep improves, then it means that melatonin can be beneficial for this person by law. Therefore, in this sense, a trial application of melatonin is quite possible. And if the effect continues, then you can continue to use that melatonin. Thus, the conclusion about melatonin, you don't need to do melatonin tests when deciding on this or other methods of treating insomnia. Secondly, cortisol is obviously a stress hormone, and if there's a lot of it, it can lead to an increase in the excitability of the nervous system. The degree of excitability of aging and so on can worsen sleep. There is research showing that in patients with insomnia, the concentration of cortisol increases, but almost a similar situation with melatonin. Firstly, cortisol can be released into the blood almost instantly. The same analysis which they take can cause white coat syndrome. So a man in a white coat, here you have jumped cortisol, or a small physical load, or some stress, or some bad news, everything can change the level of cortisol in the blood. If we are talking about some other diseases where cortisol is taken, and there, for example, adrenal diseases are allowed, it depends and so on. And if, as in the case of insomnia, then there are also no clinical recommendations for the need to monitor cortisol to make a diagnosis and prescribe treatment. So once again, I emphasize that this is not a standard analysis when a person comes to a reception with insomnia. I probably can express, and we endocrinologists, nutritionists, and so on and so forth, that in their opinion, yes, this is extremely important, but I still try to rely on serious clinical studies on the basis of which clinical recommendations, clinical guidelines are formed. So in these recommendations, the analysis for cortisol is not present. Third, adrenaline and noradrenaline. This essentially is another block of stress hormones. They are even more, let's say, sensitive to certain external influences. Something scared you, causing an immediate release of adrenaline. A car honked from behind as you were going. And it kind of, so to speak, scared you a little. Adrenaline just spikes, but then it goes down fairly quickly. At the same time, just if you're having a blood test and you're afraid of blood tests, then your adrenaline will sharply increase at the moment of blood draw. Therefore, here too, one must be very careful to somehow analyze these stress hormones, especially in relation to chronic insomnia. And once again, I underline that there are no clinical recommendations for adrenaline and noradrenaline tests as necessary for the diagnosis of insomnia. I always mention clinical recommendations. It's interesting that now at the top of the clinical recommendations, it may not be about diagnosis, but about treatment. There is what is called cognitive behavioral therapy for insomnia, which is aimed at treating conditioned reflex insomnia, which is not based on any tests. It's just a thorough questioning of a person when we identify conditional negative reflexes, negative thinking, maladaptive behavior, life image. And this is supported by a thoroughly collected anamnesis. And by the way, I want to say that the most effective method of treating such a conditional reflex insomnia is cognitive behavioral therapy. I implement an author's program of cognitive behavioral therapy for insomnia, which allows most patients to cure chronic insomnia within 6 weeks to a month and a half without the use of sleeping pills. In the description to this video, you will find a link to the program and how to sign up for an appointment with me if you suffer from chronic insomnia and want to get rid of it. Fourthly, I want to say that doctors very often prescribe various tests for viruses. Viruses of simple herpes, Epstein-Barr, and so on down the list. Perhaps these viruses can impair a person's functioning, cause some possible complications. But there are also no serious studies that say these viruses that live in a person can cause insomnia. Another thing that's important is which antibodies, so-called, to take. Having antibodies means that at some point a person has come into contact with this virus. I want to say that the herpes virus is practically found in everyone. That is, 97% of the population is infected with the herpes virus. Only 3% have some specific acquired immunity, and they do not have this virus. And the same antibodies to the herpes virus are found in almost everyone, just like in Epstein-Barr, just like a number of other viruses, and this does not help us make an accurate diagnosis. And I will say literally at the last appointment, a patient came to me who started having insomnia a year ago after stress. And they took her tests for viruses, and for almost a year they applied interferons, some antiviral drugs and so on. Then they started treating the intestine because problems started there too. And the insomnia remained as it was. In general, stress and depression were blamed for everything. And it had nothing to do with viruses. Another thing is that yes, if there is an obvious clinical viral infection, let's say a herpes virus causing herpes, there will not be immunoglobulins, but immunoglobulins M. This is so-called acute phase, that is, it is either a primary infection or a reinfection. Then usually these are certain clinical manifestations of these viral infections. And the mere presence of these viral infections without clinical manifestations is unlikely to have any effect on sleep quality, let alone cause insomnia. Therefore, there is also no great sense in making this large panel for all possible viruses in patients with insomnia. Next, gut microbiome. In general, there is a good expression that the gut is our second brain, and there we have 7 kilograms of various bacteria living and viruses and so on, which have been cohabiting with the organism for many millions of years. That is such a symbiosis. And that these or other changes in his microbiome can cause serious sleep problems. Maybe I deny. Well, in general, if you just have, irritable bowel syndrome, diarrhea, constipation, irritable bowel syndrome, it's quite understandable that this can worsen the quality of sleep. Moreover, I would say that often irritable bowel syndrome is not a problem with the microbiome. It's psychosomatic diseases. The term bear disease refers to a condition where a person experiences diarrhea when they feel afraid or anxious about something. What do we have there? Did the bacteria become active in the intestine? No, it's such a reaction of the vegetative nervous system in the form of increased intestinal motility and, accordingly, loose stools or even diarrhea. Or also called functional dyspepsia. A person eats a little bit and he feels like all digestion has stopped, and as soon as he stops eating, he immediately feels a burning sensation. He also needs to eat something. Well, in general, such a pathology is associated with the intestine. And this is also an obvious described situation within the same anxious depressive states when the intestine reacts to psychopathology. But so that the microbiome itself exclusively determines whether a person sleeps or does not sleep, there are no such serious evidential works. And once again, I underline that there are also no indications in the clinical recommendations that it is necessary to study the intestinal microbiome and on the basis of this to diagnose some sleep disorders. If you have had the experience of handing over this huge amount of tests, sometimes hundreds of different tests, please write this in the comments what they took from you. Yes, how they analyzed, most importantly, what conclusions they made. In this sense, I will say, perhaps deviating a little from the topic of insomnia, what kind of problem nutritionists sometimes have when they take a lot of tests and even see some changes in parameters, but it is still not entirely clear what this change in parameter leads to, but everyone tries to compensate. And a person is prescribed 20, 30, 40 drugs at the same time. And there is such a concept as polypharmacy. This is when many drugs are prescribed at the same time. It is generally believed that if more than 5 drugs are prescribed to a person at the same time, how they will interact with each other is absolutely unclear. And if more than 10 drugs are prescribed at the same time, the risk of side effects or some negative interaction of the drugs is often higher than the benefit of using these drugs. It's one thing if a serious integrative doctor prescribes something, but sometimes nutritionists who have gone to study for 2 months and then prescribe 150 tests and then 40 drugs. Here, softly speaking, is the wrong approach from the point of view of possible correction of some deficiencies in the human body. And I said that I would tell you about those tests that are purposefully taken, and generally speaking, they can demonstrably affect the quality of sleep or worsen sleep or lead to insomnia. First of all, this is a general blood test. This is a biochemical standard blood test. This is a blood test for vitamin iron group and ferritin metabolites because it is obvious that iron deficiency causes insomnia as well as other parameters. And also a test for thyroid hormones because both hyperthyroidism can primarily cause insomnia, but also hypothyroidism, a decrease in thyroid function, can also lead to sleep disturbances, in particular to the appearance of snoring and apnea. That is, in general, this is not such a large volume of tests, although yes, they need to be passed, because if some disorders are revealed there, then it is known that this can definitely worsen the quality of sleep, cause these or other sleep disorders, or even let's say the same snoring, apnea or restless leg syndrome and periodic limb movements in sleep. For example, iron deficiency obviously provokes the fact that the limbs begin to twitch in sleep, and this can lead to the development of serious insomnia. In general, I would like to underline once again that it is necessary to approach everything sensibly and to base oneself factually on some parameters of evidence-based medicine, clinical guidelines, in which this list of tests is given. You can see right here on the screen which tests it makes sense to take in order to primarily figure out, exclude any somatic problems that can lead to sleep disturbances. I specifically provide such informational videos on my channel so that you better understand what kind of sleep problems there can be. Subscribe to my channel. There are many useful videos on how to improve sleep, how to combat sleep disorders, and how to ensure sleep hygiene and sleep quality. Don't forget to click on the bell so you don't miss my new interesting videos.